Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Having a cesarean section delivery can be very scary. Today we'll be explaining everything you need to know about what to expect in the operating room during your cesarean section delivery. So hit those like and subscribe buttons and stay with us. Once you find out you're going to be having a cesarean section, it can be very overwhelming. And it's important for you to understand what to expect in your operating room, starting by what does it even look like. So for one, when you go into the operating room, you'll be on a bed. And when you first get there, you're going to notice that it is very cold. The colder the room, the lower the risk of bacteria growing, which is why they keep it so cold at all times. Next, you're going to see bright lights everywhere. In fact, some people will describe it as blinding. Your eyes will adjust to it, but this is so that everybody can see everything during your surgery. Now, you will come in a very comfy bed, but they're going to transfer you possibly to a metal table. That's the operating room bed. It's very, very hard. And that's okay because they're going to position you for comfort. There's going to be a bed in the room also for your baby. It will be a warmer, so it'll have an overhead light to it. You're going to see equipment all around. All of this equipment is designed to help keep you and your baby safe during the procedure. You may hear a lot of sounds in the room. You may hear hissing of gas or beeping from the different sounds of the vital signs machine, the anesthesia machine, even the baby warmer as it warms up. And everybody around you is going to be wearing masks and gowns and head coverings. This is to keep the room as sterile as possible to reduce your risk of infection. Next up, anesthesia. This is one of the biggest things that run around in your head because you want to make sure you don't have any pain during your surgery. So the anesthesiologist or the anesthesia team will usually be at the head of the bed. Their job is to medicate you for everything, for pain, for anxiety, for nausea. And I say this because if you are feeling anything, they can help. They oftentimes will guide you through the procedure. They'll let you know exactly what's going on in the room because you won't be able to lift your head much. They can answer all of your questions. They're going to go ahead and they're going to monitor the medication that you're getting. They're going to check your vital signs like your heart rate and your breathing rate and your blood pressure. And their job is to keep you safe during the entire procedure. Once you're in the room, they need to set you up. So first, they're going to have you get on the operating room table. Now, if you've already had an epidural or spinal put into place, you're just going to lay down. If not, they're going to have you sit up on the edge while your anesthesiologist places your spinal. Next, they're going to lay you down, and they may have your arms stretched out beside you. This is to help them monitor your vital signs. They're going to put a pad onto your leg to help prevent any electrical shocks that could happen with the equipment. They're also going to put in a urinary catheter. When you have a cesarean section, afterwards you can't get up and walk around right away because of the anesthesia. You may also have trouble feeling whether you need to go to the bathroom, which is why we use a urinary catheter. Then they're going to check your baby's heartbeat one last time. They want to make sure baby still sounds good. They're going to put some oxygen in your nose via a little tiny tube to make sure that you're breathing very well. Then they're going to put this big drape over you. It's like a big sheet with a little barrier between you and your belly so that you don't actually see the surgery taking place. They're going to clean your belly with an antiseptic solution, and it may feel very cold. And while all this is going on, staff are going to start to come into the room and they're going to start counting equipment that's going to be used during your procedure. Please remember to hit the like and subscribe button so you can get our latest content. Okay, so the room is set, it's time to give birth. So the last few things are going to take place now. They're going to test the anesthesia. And what they do is behind that drape that they've put up, they're going to use a sharp instrument on your belly to make sure you can't feel that at all. Then they're going to make sure all the staff is in place, especially the staff that's going to take care of your baby. They often show up right at the very last minute because they're usually part of the neonatal intensive care unit. Now, don't be afraid of this. This is just most hospital procedures. You may see 1 or 2 people, or you may see 6. That doesn't necessarily mean something is wrong. That simply means that's how your hospital operates. Then they're going to do something called a timeout. This is the chance for everybody in the room to make sure everything is set, all the people are there before they start your operation. Once that's been done, your partner will usually be brought into the room. They will start the procedure, and you may feel some pressure on your belly. This is normal. Before you know, often within 1 to 2 minutes, your baby is born. They will lift the baby up and put the baby over the curtain so you can see your baby. If you want them to, they will announce the gender of your baby. They will allow your partner usually to help cut the cord, and then the baby will be brought to the warmer for examination. Congratulations, the baby is here. Your baby has been brought to the warmer to be checked out by their healthcare providers. They're going to check everything, including the measurements, and determine if your baby needs additional care. Now, sometimes babies will be a little bit off when they're first delivered. They may be breathing too fast, or their temperature may be too low. Don't be upset or concerned if the baby is with the providers longer than you expect. Every baby is different, and those healthcare providers are trained to let you know what's going on when you need to know it. They're also doing other things. They're taking your baby's footprints and they're putting bands on for safety. Once all of that is done, they're going to let you see your baby. As long as the baby is safe, they're going to show you the baby, and they may even do some skin to skin while you're still in the operating room. After spending some time with your baby and your partner are probably going to leave the room and go to the recovery area where you will soon be joining them. At this time, your doctor and some of the surgical staff are going to start to close up your incision, usually with either stitches or an adhesive glue. And then they're going to put this really big bandage on top. This is to put pressure on your belly to allow that incision to heal. Next, they're going to clean you up from the surgery because surgery does involve a little bit of blood, and you will still have some blood coming out of your vagina. So they're going to put some pads there as well. Next, they're going to remove any of the equipment they needed only for the surgery, like that pad to reduce the risk of an electrical shock. They're going to help you move to a stretcher, and they're going to put fresh, warm, clean blankets on you. And then you're going to be rolled out of the operating room and brought to your baby. I hope this video has helped you learn what to expect in the operating room when you have your cesarean section delivery. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe buttons so you can get our latest content on pregnancy, labor, and early childhood parenting. Share our video with your friends and family, and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.